everyone, and welcome to the Science Out East podcast from the University of East London. My name is Karl Smith, Head of Research Excellence at University of East London, otherwise known as UEL, and I'm your host today. So, on this episode, we will be discussing how to improve housing for young people and the importance of representing young people's voices in research. So I'm very pleased to say that I'm joined today by one of my favourite colleagues, Dr. Darren Sharpe. He's an associate professor and the interim director of the ICC. It's the Institute for Connected Communities. Darren, great to have you here.
Good morning, Karl. Good morning, yes.
I know you've had a really interesting life. We were talking off air just before we started, but can you just do tell us a bit about yourself, how you got into research and what brought you to University of East London?
Okay, well, look, that's kind of an interesting story. I don't know where to quite begin, but I guess the beginning, I see myself really as the legacy of the Windrush generation. So my family migrated separately, in terms of my father and my mother, to the UK in the 1960s. They followed my grandfather, who came in the 1950s. And so I grew up in the Midlands, and so I grew up in a very small black community, in a mining community to be exact. So I was aware of my difference from a very early age. I was often the only black child in my class, on occasion the only black child in my school. So even before I became an adolescent and started to explore who am I and the questions around identity, from a very early age it was acute to me that I was different. For me, that was really one of the things what sparked my sociological imagination. Understanding my difference and where I fitted into this rich tapestry.
Well, and just to say, it's very, what really strikes me there is hearing how your ethnicity really informed your whole outlook, because when you grow up as the one person who looks different to everybody else, it probably has a profound effect on you. But what I think is really positive, how you used this experience, which was probably very challenging, to really have a very positive effect on your future career. Can you talk more about how you went from this position where you probably may have felt, to use that word, marginalised? I don't know whether that's the right word to use here, Darren, but how you went from that position, the one black boy in the Midlands in your class, to being where you are now, which is, to my mind, actually a very eminent academic.
Yeah. Well, thank you, Karl, for that. Well, there was a number of factors, really, and although I was marginalised, I was never discriminated against. Yeah. So I've never experienced overt racism because I was, again, such a minority within the majority. I was never considered a threat. And so I experienced a very good education, actually, and I developed very good networks where I lived. I grew up in the 70s and 80s, and it was a very turbulent time in Britain. There was a lot of kind of social activism, what again fueled my sociological imagination. So from one extreme, you had like Green and Commons. So you had feminists, what was camping and protesting around nuclear proliferation. You had the race riots, what occurred, of course, in Brixton and across the entire country and in the communities close to where I lived. And you also had that threat, that ubiquitous threat of a nuclear bomb. I don't know if you remember going back to the 70s, we was all taught how to survive a nuclear holocaust. And then to top it all off, I was right at the centre of the miners' strike. So I lived in a mining community, although none of my family were miners. I witnessed firsthand in my community, in my school, the impact of the miners' strike. Families who were striking and families who weren't striking, and our communities became disconnected. Both the community became a battlefield, as well as the school. As children, we would play that out. And so all these things were kind of building blocks. At that moment in time, of course, I didn't know I would become a social scientist, but these were building blocks for me as I started kind of my academic career from primary school to higher education.
And can I just say, what really struck me there is that, so you were the community that in many respects began to fracture. You had those who were on the picket line and those who were actually still working. Yeah. You also had, obviously, there was sometimes fractures on the basis of ethnicity, and we're very much conscious in the Midlands as well. You had immigration there from many parts of the world, such as, for example, India and Pakistan and so forth. So you were in this environment where you had a lot of divide within the community. But then now what I think is fantastic, and this is almost like a wonderful denouement conclusion, but you're now in the Institute for Connected Communities. And I want to hear more about that.
Yeah. Well, yeah, I like my biography is illustrated. Yeah. I lived through and I've witnessed so much disconnection from my roots in the Caribbean, Jamaica to be exact. The disconnect, what I witnessed in communities. And when it comes to the mining communities and families, still till today, families do not talk because those wounds run so deep in terms of those who picketed and those who went into work. And over the successive decades and years, we've seen, even till today, how fragmented and how fragile communities are. And so, for me, I'm passionate about using, you can say, the sociological lens or research lens in order to, as one source, to bring communities back together. It's not the only answer, but it's part of the answer. By able to articulate the needs of communities through research, through good quality research, but at the back end, use good quality research to bring communities back together. Because although it's a well overused saying, there's far more what brings us together and similarities than what divides us.
And what also really struck me there, Darren, how your institute embodies that connection in the sense of when it was founded, you had the health and well-being people who were brought together with the people looking at online harms. Yeah. But I want to talk more now about young people, okay, and especially in the context of the research that the Institute for Connected Communities does. Can you describe some of the projects you yourself have been involved with, Darren, with the ICC?
Yeah, sure. Yeah. So my research really focuses on children, young people and vulnerable adults. And leaning back, actually, before joining academia, as well as during academia, I've always been conscious about triangle of research, policy and practice, that each must drive one another in order to create real societal change. And so I made it my mission that rather than just researching and talking about people, I wanted to understand the services I research and evaluate. So throughout my career and my time at ICC, I've dipped out for periods and I've worked in every sector. I've spent a year in secure accommodation. I've spent a year working on a psychiatric ward. I've delivered Meals on Wheels. Wow. I've taught reception school all the way through. So I followed you can say the social life experience of children and young people and vulnerable adults. One conclusion I came to was that you see the same families represented in all the services. That's the irony. The same family members, it may be that mum is going to one service I'm evaluating, the eldest son is going to another service I'm evaluating, and the younger daughter is also going to a service or a school I'm evaluating. And so for me, policy and changes in practice is so important to create that holistic change. And that is really why you can say why communities is so important in the Institute or in the title of the Institute, because you've got to look at family units and the community setting in order to do real change or meaningful change. You can't just address one person's need. You have to address the family's need or the community's need in order to make sustainable change.
So in other words, when you're looking at young people, you can't look at them in isolation. You've got to look at their home life environment, who their parents or parents might be, their siblings, the school they go to and so forth. What I'm also keen to hear about that, you mentioned service evaluation. what were the kinds of services, or what are the kinds of services that you have been evaluating?
Well, yeah, on that note, in terms of my research, it's broad in the sense that I do really kind of needs-led research.
Yeah.
And so it's really, in terms of children, young people and vulnerable adults, what do local authorities need evaluating and researching in order to better address the family's need and the community's need? So I do studies from evaluating mental health programs in schools. I do research looking at citizenship and young people's participation historically in European elections and British elections. I do evaluations for the NHS, so looking at how do we increase uptake for women with learning disabilities to attend breast screening appointments? How do we increase uptake for people where English is a second language in order to do breast screening? I evaluate new tools that are being implemented across the NHS around kind of self-referrals for cancer, and that could be for men, women, children, young people, so to speak. So I do a range of evaluations, not led by what I think is interesting and I think is important, but more about what does the public sector and what do communities feel are important to fix that one element of the jigsaw, what we call social life.
Yeah. And it's just hearing that down as well, what really struck me is that we spend quite a bit of money on services, but fundamentally, what is our understanding of their efficacy, of their effectiveness? Often these are questions that are based on, the answers to those are based on very limited evidence. And I feel you're trying to fill those big evidence gaps or those data gaps on which services are effective. And crucially, what also strikes me, you're trying to get the people who use those services to help answer the questions with you. And I think that's something very true, would you say? The participatory model, where it's not just you looking at the researchers, you're working with the service users, you're working with the service users to find out what works best.
Well, very, very much so. And that is really my lane, participatory research. Yeah. And it's both listening to the commissioner, so it's done by design. So I work a lot actually in the commissioning stage and helping to develop business cases so they can scale and embed interventions or new services, which I've gone and tested in order to increase reach, increase uptake, and making sure ultimately it's the right service at the right time. And that also means listening into what residents, patients and service users say they need. For example, I did a very big piece of work at ICC at the time, looking at recommissioning diabetes services for young people in Newham. Newham, not many people know we've got such a large youth population, probably one of the largest in the country in terms of our demographics of young people. We was also the first borough to diagnose, or first place globally to diagnose type 2 in young people. So it's an epidemic, type 2, in Newham. So a lot of people diagnosed weren't attending their appointments. Diabetes is one of the highest costs for the NHS, the kind of side effects stemming from poorly maintained diabetes. So it's important that people with diabetes are accessing the right services. The challenge for the clinical commissioning group at the time was that young people weren't attending the kind of services put on for them. So working with young people who have got diabetes, training them up as young commissioners who were able to then support the research and help design the research, talk to other young people, talk to practitioners. We was able to then co-design and co-develop appropriate services for young people, working with Bart's Hospital, working with the clinical commissioning group, and working with the young people to actually bring this into reality. And hopefully we saw kind of an increase in young people then accessing diabetes services. One classic change what we made was about offering and mainstreaming virtual appointments. This was pre-COVID. This fitted far better into their life. So it didn't mean that they're pulled out of school for 2 or 3 hours. in order to attend an appointment, which only lasts for 15 minutes. It meant that they was able to have that autonomy and feel confident to tell their clinician the truth. Most young people went into clinical appointments and just lied all the way through because they didn't want to get told off for why their blood sugar level was so high.
Yeah.
The reason why it was often so high, because they wanted to join the football club, because they've just gone to university and want to experiment drinking and clubbing. All these kind of developmental stages and processes we all go through to find our identity at the end of it. Young people with diabetes also live through that, but they weren't able to disclose that to the doctor because they were scared of being told off.
Sure, being judged.
And being judged.
Yes.
That's right.
Yeah. And so, again, what I'm also hearing, though, how you so successfully worked with young people. And that leads actually to my next question. What do you think is the best way of working with young people? I mean, clearly involving them as equals might be part of the answer. But what else should you say for our listeners? What's the best way to really get young people working successfully with you?
Well, yeah, and I, it's not as challenging or as difficult as one may think. To begin with.
Yeah. I might have a few prejudices here, as Darren can hear. I'm a middle-aged man, but go on,
It's all about the invitation and the offer.
Yes.
So it's about kind of identifying all young people aren't homogenous, of course. They're very different. They've got different motivations, they live very different experiences. So it's matching or knowing yourself. Do you need to match the right young people with the project you're trying to undertake? For example, diabetes, the project, what I've just mentioned, I recruited young people living with diabetes through local clinics who want to make a difference to local clinics, as opposed to any random or open invitation. So, but sometimes I've worked with young people with an open invitation, if we're talking about young people and citizenship rights, for example. So knowing, it's like if you're going to recruit for a job, knowing what is the person specification to qualify that individual to get on board. Once you've done that, knowing what support structure or systems do you need, will you be giving them vouchers, will you be paying them, or will you be remunerating their time in some other way? Again, with the diabetes group, knowing that food intake is very important. It's part of their condition. So when I'm meeting them, I'm bringing refreshments with me. Because I know low blood sugar level, even with myself with no diabetes, my creativity drops. So it's about ensuring that you're properly resourced. And so that could be from bringing the right refreshments to, with my diabetes young people, they worked and had a desk at the clinical commissioning group, getting them an ID card, getting them an email address, making them feel legitimate. They're not phonies. They're part of a research team. And although, unlike myself, I've trained in research methods and methodologies for the last 20 years, they are not coming with the kind of methodological knowledge. That's what I bring to the group. They're bringing their lived experience and their critical lens. And yes, I try to support their learning. So they're looking at all the data and all the conversations more critically. But my expectation is that they're not going to become mini researchers. But what they are active citizens who, through a bit of training and support and drawing on their lived experience, can add to the discussion and add to the debate.
And hearing that, Darren, because what really strikes me, you make sure you treat them as individuals, So again, I feel it's almost exemplary, because I think you're just challenging. There are so many preconceptions people have about young people. And that probably also aggravates young people's behaviour.
It does. Yeah? Definitely. And if I could just add one more thing as well about my expectation from them. So if they're engaging with me, my expectation is that they do participate at whatever level is comfortable for them. And normally a time commitment would be for about 3 months. in order so we can get under whatever activity we're trying to do with them. I never ask for more than 3 months, because a year in a young person's life is probably like 5 years in an adult's life. Time is elongated.
Yes.
If you remember your summer holidays.
Long time ago, go on.
Yeah, if you remember your summer holidays as a child, they would feel like they went on forever.
Yeah.
And so 3 months realistically is a time frame what a young person can work within.
Sure.
And they'll know whether they've got exams coming up and how much homework they've got to deal with within those 3 months. So I'm okay for them to dip out and dip back in again, but it's all about open communication. And it's respecting them for where they are at in their journey.
But I also, what you're doing there very well, Dan, is being empathetic towards them. And you're thinking, yes, so when I was 15, 16, 3 months was a very long time. So, Dan, but now coming to the topic of the episodes, housing. Now, we both live in London, the London area. We know how expensive accommodation is, and it is a critical part of our lives. It underpins our lives. Can you talk us through what are the pressing housing issues in the UK, and especially for young people?
Okay, well, we are in a housing crisis in the UK for several reasons.
Yeah.
From a young person perspective, I guess the current term to describe those affected are the boomerangers. Yeah. Those older, and I guess we're talking people in their 30s generally, who cannot no longer afford to live independently. So they go back home to mum and dad and try to save, whether it's for a deposit, for a mortgage, or a deposit to get into some kind of rented accommodation. They're the kind of what is more commonly talked about. And I think we all know such an individual. What we don't know about are those young people who are living independently without families and without the right support networks. And that is really where a lot of my research currently is pitched at.
Yeah. And what happens to you? So those young people who don't have a mum, a dad, who they can retreat to, and we all know people who've done that. But what happens to those young people who don't have that support network, where there's a home and there's a warm bed and so forth?
Well, the most extreme case we know about is about street homelessness.
Yes.
We've got surface oafing. However, the local authority are required to support vulnerable young people in those circumstances.
Yeah.
So a number of them, they no longer are entitled up until the age of 18, I believe, to actually have their own independent accommodation, but they will be given supported accommodation. Supported accommodation is really group housing. Yeah. With additional wraparound support. That means significant adults are there. Some services are kind of drop-in. Some services are 24 hours. However, there's an adult on site who is providing support in terms of developing life skills and general maintenance of a building. And so a large number of young people across the country are living in supported housing. Yeah. They normally come from either the care system, who clearly there's been a rupture in their family networks, that's why they were in care, or these young people have experienced some kind of argument and disconnect from their families and either being thrown out or has opted to leave, but they find themselves alone seeking accommodation.
And Darren, just looking at the notes I have here, I understand actually you actually do some work with the local police force. Is that right? And training them in terms of how to deal optimally, shall we say, with young people who have housing challenges?
Yeah. I finished a piece of work, and it was a multifaceted study, really. Yeah. And working again with young people as co-researchers, and these young people lived in supported housing, working with Dudley Council, who was driving this process, and also working with housing providers. What Dudley Council wanted to do was develop a standard in terms of the supported housing provision in their borough. Their challenge was that they're paying for young people's accommodation, and it's a large bill, and this is public money we're talking about, which we know isn't infinite, is limited, and every department, every council are always being asked to make cutbacks. They're paying for, I would say, 4-star hotel treatment, often for young people who are receiving 1-star. And so they wanted to balance this correctly. So a lot of public money was being spent supporting for very poor outcomes. Yeah. And we're talking about the physical space as well as the care, pastoral care afforded to young people to develop their life skills and their road into independence. At the time in developing this new standard or kite mark, nothing existed nationally. The standards what supported housing had to adhere to was no different from a private landlord. Wow. So we're talking about making sure you've got a fire alarm in place, etc., etc. Yep. You're Corgi registered or proofed in terms of your gas and electricity. There was nothing what drilled down into the quality and the impact of the support and the provision. Whilst we was developing this kite mark, off the Department for Education and Ofsted, they was developing a standard, and so we then looked at this emerging standard, and then we merged the two together to ensure that the Douglas standard was fit for purpose going forward. And we co-developed that, and now it's just been launched. And hopefully, what that would do is just raise the standard of supported housing in the borough, but most importantly, share their best practice nationally based upon the new standards what have been implemented. And just going back to your initial question about the police in Dudley, linked to the kite mark, another problem what was identified was policing communities where you got a group of homeless young people or young people who were previously homeless living in supported housing. Without kind of overusing the term feral children, who wants a group of feral young people in their neighbourhoods? So they was always being perceived as a problem. And I would say they aren't a problem. Their life circumstances have been a problem. But we often incorrectly focus our attention on the wrong problem. And so there was a pivotal role for the police to play, not in terms of law enforcement, but working with the young people directly to understand their problems. So if you've got a neurodiverse condition, that is why that young person may be kind of fidgeting in front of you or interrupting the questioning when you're talking to them. So it was about educating the police a little bit about what the types of young people, what would be living in supported accommodation, and the kind of conditions and experiences. So when you're interfacing with them, try to de-escalate rather than to escalate based upon their biographies. Equally, when it comes to supported housing, what a supported housing officer needs to know, am I accommodating 10 young people with history of arson?
Sure.
They don't know that information. The police know that information. And the police knows about young people who are being accommodated out of borough, because that's another thing local authorities do. They move young people around outside of their family environment or their neighbourhoods. So there was a piece in this work about the police sharing their intelligence with supported accommodation providers in order to create the right balance in any supported accommodation. So you do not have an accommodation with a group of young people all on the sex offenders register, all who have experienced arsonism, all who are using Class A drugs or an history of Class A drugs. That way, then, it creates a more connected community, going back to the connected community. Because it's communities, it's the neighbour, the elderly couple, or the young family living next door to a supported accommodation. They experience some of the perceived problems.
Sure.
And the police are responding to their needs, not the needs of the young people or the supported housing providers.
Indeed. And what's really powerful, though, again, it's this word empathy, because what you do when you speak to the police or you speak to the housing services, it's making them realise when a young person maybe has problematic behaviour, that's normally a consequence of their environment and their history, not for the young person being innately bad, to use that terrible term. And this is so crucial. For our listeners at home, what can they do to help get involved with improving conditions for young people?
Wow, that's an interesting question. And I think we've all got a role to play. So it's not just on the public sector. It's not just on teachers or schools or your doctor or the community nurse, so to speak, what plays a role. I think as community actors, we should be supporting all those public bodies. So it's not just for the police to kind of respond and kind of monitor social behaviour. There's a role for you to kind of remind people to pick up litter. And to put the litter in the litter bin. There's a role for you to kind of point out antisocial behaviour. There's also a role in terms of parenting as well. There's a role for you to kind of prepare your child for school. There's a role for you to make sure that your son or daughter are attending their medical appointments. But most importantly, it goes back to your earlier question, we all need to listen. We all are very good at talking, but we spend less emphasis and train ourselves less on the listening part. And it's about creating those spaces, whether it's domestically at home, whether it's at school, whether it's in a clinical appointment, just to listen. If you give young people the space, and the problem is, and what we always forget, I don't see young people as different species. The only thing what separates us as an adult and a child is an accumulation of experience. And being able to reflect on that experience. And it's arguable whether all adults can reflect really and build on their experience. But that is only the distinction. It's that accumulation of experience. So young people living through an experience, an adverse experience, they may not have the words to articulate it yet, but you need to give them the space in order to explore and to express themselves, to arrive at an articulation. And I think that applies to at home, at school, out in the leisure space, as well as if they're receiving medical care as well.
And really, what strikes me there is just humanising young people. They're not the other. They're just us at a younger age. And listening is so key. And that, for me, is also empathising. But I'm aware of time, so we're going to have to wrap up. But a very final question. What do you think the youth sector wants or needs from government? How can government best support the youth sector?
Oh, well, this is a challenging question. We're in a new government, and the new government focus at the moment, as it relates to young people, seems to be centred around street safety. And we do know that particularly young women, both on public transport and off public transport, are concerned about their safety. If we look at statistics and figures, we know that it's predominantly boys attacking other boys. That is driving, you say, the street level criminality. So there's a clear need for the government to make sure that young people feel safer on the streets. And this could be done through just very practical steps. I've done a study, for example, this was, I can't remember which recession or austerity this was, but one local authority decided to turn off their street lights.
Cost-cutting extremes.
Cost-cutting extremes.
Left the community in the dark.
They left the community in the dark after a certain time. So people going on their, I don't know, Friday or Saturday drink, as soon as they left the immediate city centre, there was no street lights. And so there's obvious practical things what the government and local government can do to better support young people. However, the biggest challenge is about supporting the voluntary sector, who are the real actors in this case, working with young people from youth centres to Christian or religious groups to self-help groups in the community. And there's a lot of them out there doing fantastic work, but their challenge is funding. Yeah. And providing sustainable long-term services. Yeah. We also know that there's a mental health crisis when it comes to young people. A lot of this, ironically, is driven by their online engagement. Yeah. A lot of it is the traditional growing, teething pains we go through as young people. One time one would be bullied on the playground, now it's more online. So these are things what maybe we can't eradicate, but what we can do, and again, this goes about accumulation of knowledge, we know where support is needed and when it's needed. And we just need to make sure that the government resources those types of support for all types of young people.
And so what I'm hearing here, it's looking at young people and their needs really holistically, because you've got the traditional services, but the voluntary sector is clearly crucial. And throughout this interview, I just did this idea of connection is really key. And that's come across so strongly. Young people are not just atomized entities. They are part of a big network, and we need to connect that network as much as we can, but also resource it effectively. So look, Darren, it's been a real pleasure to interview you today. And I know we've really got over time because I've enjoyed talking to you so much. So thank you for joining us. Thank you to our listeners who are listening at home. This episode was recorded as part of UEL's Year of Science. So please do follow us on the usual social media channels and online to keep updated on our episodes. But thanks so much once again to,
my pleasure,
to Dr. Darren Sharpe, soon to be Professor, we hope, and also to our producer, Maria, and our sound engineer, Dr. Patrick, as well. Thank you very much.